Osgood-Schlatter disease is a harmless bump that appears just below the knee where the shin bone tibia meets a small piece of bone called the tibial tubercle. It most often shows up in kids and teens who are still growing, especially those who play sports that involve a lot of running, jumping, or sudden stops. The condition is not an infection. It is simply irritation of the growth area at the front of the knee. The main cause is repeated pulling traction on the tibial tubercle by the strong tendon that attaches the quadriceps muscle, the big front thigh muscle, to the shin bone. When a growing child runs, jumps, or kicks a ball, the tendon pulls on the still soft growth plate, making it inflamed, and sometimes a small piece of bone can break off. Kids who grow quickly, have strong leg muscles, or do a lot of high-impact sports are most at risk. Typical signs include a tender, painful bump right under the kneecap. That gets worse during activity like running or climbing stairs, and eases when resting. The knee may feel stiff, and the child might notice swelling or a visible lump. Sometimes the pain wakes them up at night, or they may avoid sports because the knee hurts when they kneel or squat. Doctors usually diagnose Osgood-Schlatter by looking at the knee, feeling the bump, and asking about the child's sports history. An X-ray can show the bump and any small bone fragment, but it is often not needed. Treatment focuses on relieving pain, rest from intense activities, applying ice, using a knee sleeve or bandage, and doing gentle stretching and strengthening exercises for the thigh muscles. Over-the-counter pain relievers like ibuprofen can help. Most kids heal once their bones stop growing, usually within a year or two. To keep the condition from getting worse, encourage children to warm up before sports, stretch the quadriceps and hamstrings daily, and use proper footwear that cushions the impact. If a child feels knee pain, they should pause the activity for a few days and use ice, rather than pushing through the pain. Building strength gradually and avoiding sudden spikes in training intensity also helps prevent irritation of the growth plate. Recent studies have looked at using short-term shockwave therapy and specialized physiotherapy programs to speed up pain relief and improve function. Early research suggests that a few sessions of low-intensity shock waves, combined with targeted stretching, may reduce swelling faster than rest alone. However, larger studies are still needed before this becomes a standard treatment.